Hi, everyone. My name is Benoit, and today I'm presenting on my time spent at Dayton Children's Hospital for my capstone and all of my great experiences there. So my main focus while I was at Dayton Children's was that I was looking at the effects of massage on autonomic stress responses in preterm NICU neonates. And so I completed a systematic review, and then I completed multiple on-site projects that were all a part of my doctoral experience while being on-site in the clinic. And then I also completed a larger project considered the Capstone project, where I actually got to implement infant massage as an intervention and as a case study and carry out a case study while I was there. Starting off with the systematic review, I think this is just a good representation of showing the distribution of live preterm births in Ohio. So these red circles that are on the map just are highlighting the 5 primary counties that Dayton Children's serves. And basically what this is all showing in a nutshell is that there is an increasing rate of premature births, and actually premature births are increasing annually. And according to the March of Dimes in 2018, 1 in 10 babies are born premature in the state of Ohio. And actually just in this last year, March of Dimes had aimed to reduce premature births to 8.1% across the country. So ultimately, what we know and what we see is that there is a need for services for this population as it is growing every year. So for my systematic review, preterm infants are exposed to a variety of noxious stimuli that cause stress within the NICU. Bright lights, loud noise, medical touch, and physical separation are all examples of this noxious stimuli. And this systematic review was completed to analyze and understand the effects of using massage as an intervention to reduce autonomic stress responses in preterm infants within a NICU setting. So what are autonomic stress responses? We were looking at heart rate, respiratory rate, and oxygen saturation. And a total of 9 studies were included in the review. The quality of evidence of the literature and the strength of recommendation was evaluated using the grade process. So it was determined that the evidence was considered of moderate quality and received a weak plus grade rating. What this means is that the intervention can be implemented, but to proceed with caution, as there is not a lot of evidence specifically looking at massage as an intervention to reduce these autonomic stress responses. The key ingredients that we identified from the systematic review is that the Tiffany field method of massage should be utilized, and it should be completed 2 times daily for 15 minutes each time, and to use oil and moderate pressure. Moving into my case study, or the large capstone project. The case study was performed on an identified preterm infant, implementing infant massage as an intervention to reduce the autonomic stress responses. The concerns and background of our identified infant: he's a premature infant that was 38 weeks and 3 days at the initiation of the case study, born at 27 weeks and 0 days. He was small for gestational age, low birth weight, had respiratory failure, myelomeningocele of the thoracic region with hydrocephalus, which was repaired in November, so prior to our case study. And the mother of the patient has a history of mental health diagnoses, and this was their first child. On initial assessment, the OT manager, who's trained in neonatal touch and massage, determined if this infant was appropriate for study. So she observed his responses to therapeutic handling and confirmed that the infant was greater than 31 weeks of age and that the infant was medically stable per nursing, so that they were not intubated or fluctuating and unstable. So for implementation, I implemented neonatal touch and massage, and this was performed on the identified infant for 30 minutes once a day for 10 days, Monday through Friday, so across 2 weeks, using lotion and moderate pressure. Heart rate, respiratory rate, and oxygen saturation were recorded pre-intervention and post-intervention. The results. So on this first graph here, we're looking at heart rate, and overall heart rate decreased post-massage, and that's that orange line right here. And respiratory rate, there was not a clear correlation, which is this middle graph right here, between massage and respiratory rate. And then for oxygen saturation, overall, it increased post-massage. And you can see that in this, again, that orange line on the graph. So oxygen saturation increased post-massage. Secondary outcomes, we had an overall increase in weight gain. We did see an overall decrease in oxygen requirements, and there was no correlation in oral feeding intake. Key findings from this case study: the infant massage utilized as an intervention is not harmful and can be beneficial in reducing autonomic stress responses, as represented by the decrease in heart rate and the increase in oxygen saturation. And this should be implemented daily in the NICU settings, as opposed to 1 to 3 times a week, which is what's currently being implemented at Dayton Children's due to their current protocols. So the final recommendation of the protocol would be that massage should be implemented daily for 30 minutes by individuals, skilled or unskilled, who are trained by certified OTs using lotion and moderate pressure following the neonatal touch and massage method. And unskilled individuals could be parents or caregivers, whereas skilled could be other disciplines within the hospital setting. And then lastly, my doctoral experience. So I was at Dayton Children's Hospital, and as I've said, and then during my time here, I did spend most of my time in the NICU setting, where much of the population are premature neonates. And I also spent time in the transitional care unit, which is also called the TCU, where all of the patients on this floor have G tubes and or tracheostomies. So a lot of them are on ventilators. And I mainly worked with the NICU graduates who end up in the TCU following these procedures. And these TCU patients have to go through family training prior to discharge. So while I spent my time divided between the NICU and TCU, I completed evaluations, treatments, discharge planning, parent education, and staff education. And my experience was heavily focused on OT's role in the NICU in the use of specific interventions to reduce stress and promote positive neurodevelopment, as well as the continuity of care for the NICU graduates that transferred to the TCU. I spent about 85% of my time on site learning through a combination of observational and hands-on experiences while being in the clinic. And then 15% of my time was spent learning through materials provided by Dayton Children's Hospital, web-based research, webinars, and research articles. So I developed a couple presentations during my time, and 2 of these were based on neurodevelopment and NICU transitions to the TCU, which I presented on for the TCU staff, the nursing staff, and on neonatal development to the child life specialists. So we covered a lot of sensory, and that's what's down here in this left corner. Just shows the hierarchical representation of how senses in the sensory systems are developed and what comes first, what develops last. And that's important because a lot of this population of preterm babies, their sensory systems are developing outside of the womb, which is atypical. And it was also highlighted about that neurons that fire together wire together. So basically saying that repeated behavior, whether it's good or bad, repeated things that happen, form pathways in the brain, and then it's more likely to be triggered in the future. So what we wanted to emphasize was overriding negative experiences with positive experiences. So reverting back to those noxious stimuli, so being able to try to promote positive experiences instead of those negative ones. As we talked about, autonomic stress responses are the heart rate, oxygen saturation, and respiratory rate. So those are indicative of stress responses when you see an increased heart rate, decreased oxygen saturation, and an increased respiratory rate, or any skin color changes. Motor stress responses to be aware of was something that we also went over, and that's splayed hands, like a stop sign, which you can see in this black and white photo down here. Sneezing, yawning, hiccuping, facial grimace, grunting, crying, pretty inconsolable, extension or arching, tremors, startles, tongue thrusting, and sitting on air. And that's where the infant will lift its legs up and its bottom up in the air. And then the last two projects that I created for staff education, I created some developmental signs for the transitional care unit for the patients on that floor, which is this chart right here. And basically it was like a my favorite things document. And this just helps parents and caregivers and other staff that's in the room to know how to best support this infant that's on the TCU. Again, providing positive experiences in order to promote the best outcomes for these babies. So that's what this chart represents, and just some examples of what that could look like. And I also assisted in rolling out the SENSE program in the NICU, and SENSE stands for Supporting and Enhancing NICU Sensory Experiences. So again, circling back to the whole development of your sensory systems, and this just integrates just providing those positive experiences from the beginning when we first see these babies in the NICU, and trying to create this continuity of care across interdisciplinary staff, as well as families and caregivers. And this concludes my presentation. Thank you so much for watching, and I had a wonderful experience at Dayton Children's.